Today we'll hear the stories of individuals who have dedicated their lives to serving others through providing direct services and supports, through program leadership and supervision, through building best practices and evaluating those practices, and for working in our administration and finance teams. They are honorable, they are compassionate, and they're living their lives in such a way as to make a difference.
In terms of looking at the awardees this year, like the ABH membership, it's more than the sum of their parts. Really our field coming together, working together to better meet the needs of individuals, to offer hope, recovery, resiliency for individuals that we serve. And when I look at the ABH membership, that's what I see. All of us collectively working together to make things better.
I sit down with so many providers and hospitals where they talk to me about how behavioral health and mental health especially is a loss for them to provide. And it is our job in the State House and across the Commonwealth to change that narrative. There is nothing losing about taking care of people with behavioral health.
We're putting about $10 million into the ESP system, but only with very clear goals that we're looking to achieve on that, and to be pretty directive about, both on the hospital side and the overall system side, what we are looking to see in an actual system of crisis care.
I've always felt that public health, we have a particular obligation to ensure that we address the needs of people in vulnerable situations, and many times are unable to advocate for themselves. We know that many of the priority populations that we serve at BSAS, which are pregnant and parenting women, recently incarcerated, men of color, and the dually diagnosed folks with mental health and substance use issues, are our priority, and we need to ensure that they receive better and more integrated care. Those efforts start with you and our service providers. You are the unsung people doing the hero's work on the front lines day in and day out, ensuring that those who are often unable to speak for themselves adequately have a voice, have a chance, and have a pathway.
This is what describes you, all of you who are being honored here today. You refuse to accept the status quo. You apply your passion to finding better ways to reach all of the individuals who are so in need of excellent behavioral health. You reach out for partnerships to do your work. We thank you, not just today when you're being specially honored, but each and every day. Because here's what you show us. You show us that treatment can work, that healing can happen, and perhaps the greatest contribution we can all bring is to continue applying the art of the possible.
So congratulations on your achievements. Thank you all for your commitment in supporting recovery, resilience, and empowerment for individuals with behavioral health conditions. I'm happy to be here with you.
The Robert Dorwart Award for Mental Health recognizes members of the Association of Behavioral Health Care who have demonstrated a personal, long-term commitment to the goals of ABH and who have provided leadership and support to the association, its members, and staff around mental health issues. I'm very honored and emotional to present the Robert Dorwart Award this year to Elizabeth Lacey. Beth, will you come up to the stage? So some of us still remember when Beth walked into a group home more than 3 decades ago with a braid down her back, Grateful Dead stickers on her car, and Birkenstocks on her feet. She also brought with her an open heart and a deep desire to help other people. So she has been profoundly committed to the mission of serving people with serious mental health conditions and others who are marginalized or neglected for the more than 3 decades that she has worked at Advocates. Beginning her career in direct services in a 24-hour group living environment and later working as an emergency services and outpatient clinician, she steadily moved up through the ranks at Advocates to her current role as Senior Vice President of Community Services. Over the years, she has brought innovative, impassioned leadership to Advocates and has overseen numerous successful initiatives in community justice, outpatient, and emergency services, among others. One of Beth's special talents is identifying emerging leaders in the organization and nurturing them. And so I wanted to share something from one of them. Beth hired me in 1991 as a direct care counselor. What I learned from her in my early career were the foundational skills which have infused my work for nearly 24 years: kindness, curiosity, helpfulness, and a willingness just to be present with people. I learned the value of a Saturday afternoon car ride and the idea that cleaning an apartment, cooking a meal, and balancing a checkbook were the very things that people needed to live a life beyond the mental health system. I learned how to hire the best people for the job, how to supervise others, and develop teams. I can honestly say that one of the best decisions I ever made in my life was accepting the job from Beth in December of '91. Beth was critical in creating the position of director, now vice president of recovery and peer supports, and for Massachusetts, a pioneering administrator in this regard. Moreover, she helped recruit the best person we could possibly have in this role, Keith Scott, and supported him with the resources and authority to build an outstanding certified peer specialist team. Her vision, commitment, and unwavering support have helped to make the team what it is today. Beth embodies the values of ABH. She spent her entire career bringing hope and health to individuals and families by promoting recovery and resiliency and ensuring access to quality, person-centered, and outcome-oriented care. She's participated as a member of ABH committees, testified regarding significant policy issues, and she's been a tireless advocate for the development of a committed, stable, and adequately compensated workforce. She's a gifted leader whose influence is felt by hundreds of people she has supported and throughout the behavioral health system. I am very proud and honored to present Beth with the Robert Dorwart Award for Mental Health.
Thank you so much, Diane. I just want to start by saying thank you to ABH for all the wonderful work you do for us providers, to better serve the people that we are here to help have better lives, and to thank you for this event where every year we have a moment to honor each other in the hard work that we do. In 1986, I was young, and I walked into a group home in Marlborough, and for the very first time I met Diane Gould. And I had no idea what the work would be like. I didn't know what the job entailed. I really didn't even understand who the population of people were. But I knew I wanted to work for Diane. Diane has supported me all these many years. I said I wasn't going to do that. I work at Advocates, and I've stayed at Advocates for all these years because of the value of the work, the belief in our mission, but mostly because I've wanted to work for Diane, a woman of incredible integrity and values. I'm so thankful for you, Diane. I could never do this job without you. She and others at Advocates have supported me through many, many, many things: the birth of my children, difficult times in my life, continuing my education. And I cannot thank them enough, and I cannot thank the organization enough for the trust and faith and partnership they have placed in me all these many, many years. And, you know, I can't not forget Bill Taylor, who encouraged me and supported me and picked on me and provided so many opportunities for me to grow and learn. I miss Bill every day. I have the most incredible team. I know everybody thinks that, but I really do. Brenda Mealy Suarez, Keith Scott, Craig Audette, Karen Williams, and Danielle Joseph. Thank you. Together we run the services at Advocates. These people make my job so easy. They challenge me, they argue with me, they complain about my decisions, they tell me that my decisions are good and not good. They work incredibly hard, they care deeply about our mission, they care about each other, We laugh, we cry, we complain, and I cannot express the gratitude I have for you guys. I really cannot. And lastly, I just want to thank my husband and my 2 daughters. Many of you in this room know these jobs are not easy and they take a toll on our families. We're on call all the time. We get called into programs at all different hours and on holidays, and our families hit the brunt of that. And so I thank them for putting up with me all these years and supporting me. Thanks a lot.